Well, again, folks, thank you very much for joining us here this afternoon with our weekday update with regard to the coronavirus and the state's effort to combat the spread here in our state. As always, I will start off by reminding people that we need to continue to practice the social distancing, that physical distancing, all the things we've talked about, that this is a very, very important thing for all of us to do. First off, if you are having those flu-like symptoms, you've got the cough, shortness of breath, fever, stay home. First thing you do is stay home. And if you're in one of our areas of a DHM, directed health measure, everybody in your household stays home too. Contact your healthcare professional, make an appointment. Don't just go into a clinic, don't just go into an emergency room. Make an appointment so they can keep you isolated. And then you will be tested for influenza A and B. And if you go through the screener, then you may be tested for coronavirus. But we need people to follow the guidelines we're talking about. It also includes making sure that you wash your hands frequently. Do it often and wash them for 20 seconds at a time. Keep your distance at 6 feet, but also make sure if you see somebody who you can see is obviously ill, stay away from them. Cough into your elbow. All these things is how every one of us as Nebraskans can be a part of slowing the spread of coronavirus here in our state. So please, everybody help out. Now, to kick it off today, I'm being joined by our Commissioner of Labor, John Albin, also our First Lady, Suzanne Shore. Also in the audience, we've got Mary Jo Pancoke from the Nebraska Children and Families Foundation, and then also Commissioner Matt Bloomstead, the Commissioner of Education. They're not actually going to be, the latter two are not going to be speaking, but they'll be here to answer questions later for the media if you have questions on some of the topics we're going to be talking about. Yesterday, we implemented 2 new directed health measures, one for the North Central Public District for Public Health, the Public Health Department, and West Central District Public Health Department. So that will add on more counties and bring us up to a total now of 56 counties that are under that directed health measure. So again, this is the most restrictive that we measure that we do, and these directed health measures will last through May 11th. So that is one of the updates that we've got for that. Also, as part of updating this directed health measure, we made clear that schools will be operating without students until May 31st. And this is just to reinforce what Commissioner Bloomstead said last Friday with regard to schools should not be operating with students through the rest of this school year. So we put that as part of our directed health measure to be very clear that schools will be operating without students through May 31st. So just so we're all clear on that. And again, Commissioner Bloomstead can answer any questions. On that topic, that also means extracurricular activities are also canceled through May 31st. And again, we are really encouraging, do not have club sports. If you're a school facility, please turn down those requests to have club sports. Look, folks, the whole point of not having kids in the classroom is that kids are the most concentrated human beings we have in our society. We put all those kids into a classroom. And the idea is that we want to avoid large public gatherings. And we say large, more than 10 people. So if we're saying we don't want kids in the classroom, it kind of defeats the purpose of that by having kids gather for a club sport that's going to have a bunch of kids, maybe more than 10 that are playing soccer or some other sport all clumping together. That's the whole point of why we're trying to break this thing up. So please, do not send your kids to club sports. Keep them separate. We're trying to keep that 10-person rule in effect here all across our state. So again, that DHM includes that. The DHM also has been updated to make sure that we're being specific about elective dental procedures and elective veterinarian procedures are also canceled as a part of that new DHM. So we're clarifying that. And again, this is all around the effort to preserve that personal protective equipment. And I would encourage dentists and veterinarians, if you have spare PPE that is appropriate, please turn that over to somebody who can use it. Think about contacting your local public health department. We talked yesterday about donating masks. This would be in that same category. Talk to your local public health department, maybe your local hospital, local clinic. See if you have the capacity. Give that PPE to somebody else. That's what this DHM is about. Now, one of the other things we're getting a lot of questions about has been the Attorney General and Dr. Fauci have been talking about stay at home, and that's the federal guidance coming from that. First of all, I want to make clear that we have DHMs in our state based on a regional approach. So what we're doing is really trying to tailor this to the parts of the state that the virus is coming to. Understanding the virus will not be everywhere in our state all at once. It will spread in different places at different rates. Our plan was put together leveraging the resources and the expertise at the University of Nebraska Medical Center. In fact, we did a Facebook Live event with Dr. James Lawler, who was one of those people who advised us on that. And our plan does not call for a shelter at home, which means basically everybody stay home and you close down all your businesses. Our plan doesn't call for that because we're a different state than states like New York that are doing that. New York was probably well seated with virus in January with their direct connections to China before anybody was even looking at this. In fact, January 20th, the Chinese government and the WHO were both saying this virus couldn't even be spread by human-human contact. So New York probably had the virus long before anybody knew what was going on or how it was even being spread, versus here in Nebraska where we didn't have those direct contacts and we are much earlier in that epidemic curve, so to speak, than New York. So we have taken these steps, like the 10-person rule that President Trump put in effect last month, to slow the spread of the virus, and they are being effective. In fact, Dr. Antone will get me the numbers, but they're roughly correct. If you look over the last 3 days, we had something like, 35 cases, or no, 38 cases, 37, 38, 36 new cases. So the number of new cases over the last 3 days has been pretty steady, despite the fact we've been doing more testing. So we do see that the effects of the social distancing, the physical distancing is working. Now, we still expect the number of cases to go up because we're doing more testing. But again, we're a different state than New York. And so we've got a different rule in place with regard to how we're implementing this. And I would also point out that our rules in some cases are more restrictive than other states that have a kind of shelter in home order out there. So for example, Florida has a shelter in home, but they've exempted religious services. Well, we're not exempting religious services here in Nebraska with our directed health measures. So these things aren't all apples to apples, so you have to take that into consideration. So we are taking the appropriate steps with a plan that was crafted with the help of University of Nebraska Medical Center. We are working our plan. We are sticking to our plan. Now, when you hear the Surgeon General say, stay at home, well, staying at home is still good advice, right? We talked yesterday with Kathy Sifkin of the Grocers Association that, for example, when you're going out shopping, don't take the whole family shopping. One person go shopping. Make a list so you can be efficient and only go once a week. That's in line with this idea of staying at home. Don't go out and do unnecessary things and stay at home, and that way you can help slow down the spread of virus here in our state. So that's kind of the distinction that you see between kind of the shelter-at-home orders in different states, which in some cases aren't as restrictive as what we're doing here in Nebraska, and this idea that the Surgeon General is saying, hey, you should stay at home, which is good advice, but it's not a mandatory lockdown because the President himself has said he understands that all states are different and that this is an emergency that is locally executed, state-managed, federally supported. So we get a lot of questions around that, so I wanted to address that up front. I hope that clarifies it a little bit more, and I'm sure we'll get more questions on it. We mentioned testing. So we have seen an increase in testing. Yesterday, we got back 696 results. That was April 1st. March 31st, we did 404. So you can see over a 50% increase in just one day. So we are testing more people. I just wanted to let people know we are working to be able to do that. UNMC, for example, has got their additional testing expanded and working. So we are working to continue to expand that testing. I know the federal government is also working on getting more tests out. We are working with the federal government to see when that will happen. We've been given no timeline from when they may provide us more machines and more assays and so forth to be able to do more testing. But we are looking to buy more in the marketplace, and we're also working with the federal government to look on how we can expand testing. One of the other things that Dr. Antone mentioned yesterday, and now I am pleased to be able to announce that we have signed an agreement with the University of Nebraska system to be able to create more bed space using the dorm rooms at the University of Nebraska-Lincoln, University of Nebraska-Omaha, and University of Nebraska-Kearney. It will create about 2,100 new beds, or 100 beds that we will have access to, And the plan for these beds is to be able to use them for folks who need to quarantine and cannot go back home to do that. So you may remember one of our early healthcare workers from Methodist couldn't go home because she had elderly parents. So people like that, people who need to isolate, and then also people who are convalescing. So for perhaps you've been in the hospital, you don't need that level of care anymore, but you need a place to go convalesce. These rooms would be available for that. The contract involves both sanitation or janitorial services and food services, and Dr. Antone is working right now on the staffing portion of that. But we believe this is one of the ways that we will be able to accommodate people who have difficulty quarantining at home, and then also be able to make sure that we can free up hospital space for the more acute needs of people while putting people into a setting that they can continue to convalesce. So we're very pleased to be able to announce that, and again, just a great cooperation between state government and the University of Nebraska. They really have been wonderful. I mean, we've talked a lot about UNMC and what they're doing. Again, we really appreciate all the cooperation with the University of Nebraska system. They've been fantastic. All right, so now we're going to move on to the unemployment section and the executive order that we updated as well. So I just signed an executive order updating our previous executive order. So this is executive order number 14. It updated number 4 with regard to our unemployment program. And what this executive order does is it updates our executive order for what was passed last week with the CARES Act that extends coverage to new groups of people. So it clarifies some of the rules around reimbursable and contributory employers. And John, I'm going to let you explain all that rather than trying to hazard a guess what that all means. I'm going to let you do that. But it also brings it in line again with these new groups of people who are going to be covered now. It also extends the waiver to August 1st, and that August 1st also is extended for our STC program, the short-term compensation program. That's the program employers can use if they want to put somebody, say, on half-time, and then let that person collect unemployment benefits half-time. So that's one of the programs that's out there. We've also, before I turn it over to our Commissioner of Labor, John Albom, I do want to highlight, we have been getting a lot of questions or hearing reports of people quitting their jobs to collect unemployment benefits. Folks, please do not quit your job. If you quit your job, you are not eligible for unemployment benefits. No matter what has happened to you, if you quit your job, this will not get you unemployment benefits. You will have to stay in your job. Unemployment benefits are people for people who are laid off due to no fault of their own. So if your employer lays you off, then you are going to be eligible for unemployment benefits. If the employer lays you off and you are called back into work and you do not go back to work, that's considered a quit. You will lose your benefits. So please, I want to stress to people, you may have heard that the benefits are going to be more generous. They will be more generous because it's an emergency, but they will be it'll be a limited time that it's going to be more generous, and it will not be there at all if you quit your job. So please, do not quit your jobs. It's a bad idea. Stay in your job. If your employer lays you off, then you will be eligible for these unemployment benefits. So with that, John, I'd like you to just come up and talk a little bit more about the executive order, what the impacts for people and employers are.
All right, thank you. Thank you, Governor. Thank you, everyone. As the Governor has told you already, the executive order was updated. As we told you when the first 2004 was signed, that we would review things as we went along. 2004 had our expiration date of May 2nd, so now it's been extended through July 31st. To make life a little more predictable, I guess, if it's predictable in these times for everyone. A couple of the changes which the Governor has underlined is we've allowed under current statute, if you have a short-time compensation plan, the statute doesn't provide that you can amend it to extend it, and that's a federal conformity requirement. The language, but in this case, we're going to allow you to extend just extend the plan rather than refile a new plan and start it the day after the old plan expired, because everybody's got way more to do than that. So we'll be extending that plan. We clarified some provisions on reimbursable and contributory employers and the non-charging. The reimbursable employers are basically governmental entities and your 501c3 nonprofits, and they don't pay a tax into the system like a regular for-profit worker does when benefits are charged. are earned based upon wages in that employment. We send them a bill, so every once in a while we send Commissioner Bloomstead a bill and say, you owe us for these benefits, and he always cheerfully writes a check, and we get paid. Contributory employers are experience-rated employers. They're a little different. They pay that quarterly tax, and then they create an experience account. Some benefits are charged to their account, some are not. Right now, with the continuation of the Executive Order 2004, that non-charging provision will carry out through August 1st. Those are the big highlights of the changes in the EO.
Hey, John, I'm sorry, we also get a bunch of questions about people who are self-employed or contract workers. Could you address that a little bit?
Yeah, and thank you, because that was what I wanted to go to next anyway. One of the reasons I'm not as prepared as I'd normally like to be is I just got off a conference call with USD Well, because nearly all of those benefits for the self-employed and that come under the CARES Act, which is federal legislation. And how that works is the state is basically treated as an agent of the federal government, and they write the rules, they pay the money, and then they actually reimburse us for our costs of administering their plan. So under the CARES Act, the pandemic unemployment assistance is available to the self-employed, the gig workers, the hairdressers, the barbers, and all those that are traditionally not part of the unemployment system. We've been working furiously on the software. We have the software in test to make it go, but our instructions from the feds as of about 1 o'clock this afternoon were, don't pay anything till we give you your actual guidance, and we think we'll get the guidance out to you in the next week to 10 days. Hopefully they can beat that timeline. But in the meantime, those individuals can go ahead and file, because one of the preconditions of those the PAU benefits is that you cannot be PUA benefits, sorry, is that you cannot be eligible for state unemployment benefits, and we're reading that to mean monetarily eligible. So if you aren't, you can go ahead and file. There's a question on COVID-19 in the process. You mark your COVID-19 shutdown, layoff. If you provide information in that claim about your self-employment that you've had, that'll help us in terms of the flag. When the feds give us the go-ahead and tell us the final rules, we'll quickly amend the software so you can do it all online at the first instance.
So, John, will somebody need to reapply if they go and apply now, and you're waiting for the feds, will they need to go back and reapply, or will you reach out to them?
We're marking those claims as they come through. We will automatically review every claim to see if they are entitled to PUA assistance. And so you don't have to come back in and do it again. And I would recommend that anyone go ahead and make their application now, because the benefits are payable as of this week. We got all the, I think it was Monday we had the press conference, we got all of the agreements signed and off to the feds on Saturday. So we can pay as to this week. When the feds will give us the go-ahead to pay as to this week, that's still be determined. But if you apply this week and start the process, you'll be eligible going back to this week. And that also reminds me of another good point under the CARES Act. As you all know, there's the federal pandemic unemployment compensation, FPUC, under that program, the $600 a week. The feds have not allowed us to go forward on that, so yet they've told us to wait for the guidance, same set of guidances that I just mentioned. What we will do on those claims is go ahead and file your weekly certifications now. Keep filing. We will pay you whatever you're entitled to under the regular unemployment benefits, and then if we have to catch up at a later date, we'll catch up your payment. You don't need to do anything. Just get your claim on file, and we'll get everything processed for you. So if 3 weeks from now they finally get us everything we need, then you'll get an extra $1,800 in the next check. So we'll get it covered. One thing I would ask people to emphasize to everyone, that with our new benefit system that we stood up in October, you can find out any information that you need about your claim. You do not have to call and see what's the status of anything, and that will help us and help you, because the computer doesn't have a hold queue, and also it will allow our people who are working on the telephones to address issues that really can't be determined underneath the claim. Whenever anyone files a claim, we automatically send them an email. Check your email box. You don't need to call us and ask if your claim's been filed. If your claim's been filed, it's in your email box. So,
You want to talk a little bit, John, we got some questions about how long should people expect to wait to get a check? If they file, how long is it taking to process the claim and get a check?
okay. Well, that's a good question.
Maybe repeat it.
No, the question is how long can we expect to pay? The federal standard that they do on regular claims is 80% of those paid within the first 21 days. So even if we do really good work, we're looking at 3 to 4 weeks before it all gets processed. I'm hoping we can beat that, but that's the process. I think it was Connecticut that was on the conference call today. They're expecting at least 40 days before they make their first payment. I certainly hope we're way ahead of that timeline. But every state's under the claims. I mean, if you look at the volume of claims that we've received, we've basically in the last 3 weeks received as many claims as we did in all of 2019. And although I've doubled my staff, that's in terms of people that are adjudicating those claims, it's still going to take some time to process. We've drafted people out of other programs. Maybe they would say conscripted, but anyway, we've pulled them into the program to help with the unemployment claims and speed up the processing. We will go ahead and release, we were hoping today they would tell us we could go ahead and pay on the $600. They didn't, so we're going to go ahead and process any claim that's eligible right now under regular unemployment and get it out the door. And then, again, we'll catch up as we get down the road. I did want to emphasize, because we've gotten a lot of calls on it, mostly from employers that are nervous. Their people are telling them they're going to quit and draw the unemployment benefits because it pays more, and that's not a good plan. If you quit your job and you don't have a valid reason for quitting it, you're still going to be disqualified and you're not going to be eligible for any of the federal benefits. And although the executive order and the federal legislation have established some extra parameters for the COVID claims, just being worried that you might get exposed to COVID at work is not good cause for quitting your employment. You need to follow the directives of your local health program. And I'm stumbling for the term, but Dr. Anton's people out in the counties. If they've told you you need to go home, then go home. But if they haven't told you you have to go home, don't. I mean, we've had a couple of people we thought were possibly COVID-19. We contacted County Health here in Lancaster County. They gave us instructions what to do. We kept our operation up and we kept going, and we'll keep going because we have about 40,000 people out there that are depending on us to get some payments made. So basically that would cover where we're at. We will try and get those benefits processed as quickly as possible. And, 24,000. I mean, I did want one thing, I'm sorry. I did want to add, because it's usually a question that somebody asks us, and that is, how's Nebraska compare to the nation? Actually, I think the strength of our economy showed through this week. Nationally, the number of initial claims for unemployment doubled. In Nebraska, they only went up 56%. And so that would indicate to me that our economy is much stronger. We're doing a good job of managing this crisis. So thank you.
So just to that point specifically, John, we had 24,527 new filings this past week, correct?
Yes.
Compared to the just shy of 16,000 the previous week.
Yes.
And our previous record during the height of the Great Recession in 2008 was like 4,000.
Yes.
Just to keep that all in perspective, how many more claims the Department of Labor is processing. So we're seeing a lot more people apply. We certainly don't want to discourage anybody, but to Commissioner Alvin's point, if you have a job, do not quit. It will disqualify you for receiving those benefits. All right, so next we're going to move on to the First Lady's announcement with regard to a project she is working on through Nebraska Impact. The First Lady is the president of Nebraska Impact, and they are establishing the Nebraska Impact COVID-19 Relief Fund in conjunction and partnership with the Nebraska Children and Families Foundation. And this is a fund that is seeking to help organizations and communities that are looking to mitigate the effects of coronavirus. And with that, I'm going to go ahead and turn it over to you, honey, and let you talk about it.
Okay, thanks. Thank you very much. Again, I'm Suzanne Shore, And Nebraska Impact is a 501c3 that was established with the mission of connecting Nebraskans across the state, bridging communities, and enhancing state pride. And we were asked to create and coordinate a relief fund, the Nebraska Impact COVID-19 Relief Fund, which will be directed through statewide community collaboratives. Now, these collaboratives are a part of the Bring Up Nebraska initiative that is administered by Nebraska Children and Families Foundation. It's a lot of words. It's about communities. It's about the collaborations within those communities. We are very grateful to be partnering with the governor's office and thank all of his staff, as well as Nebraska Children and Families Foundation. And we have Mary Jo Pankoke here who's helping with us. Thank you for everything. These funds will help individual communities meet their needs depending upon their unique and particular circumstances. Now, this could be helping their citizens meet needs for paying rent, mortgages, utilities, or it could be to help subsidize and support food pantries that find their supplies depleted, or it could be to help secure and procure school supplies for low-income students who are now having to study in their own homes. It all depends on what that community's needs are. These community collaborations assure that the funds will be used in targeted, strategic ways that meet those individual communities' specific needs. And these collaborations, what they do is they bring together community players, including civic leaders, business owners, service providers, educators, healthcare providers, the law enforcement, government officials. It also includes people from the Nebraska Children and Families Foundation and the Department of Health and Human Services. They all come together to help solve those communities' problems. And these collaboratives have proven themselves to be reliable resources throughout the state. In various ways, I know them because I've helped work with them as they improve the outcomes for children and families by providing focused prevention support services, but they've also provided the leadership and the coordination during the 2019 floods. They have proven themselves to be great partners and provide the kind of local leadership that's absolutely critical in overcoming any emergency. And I can't say enough words of thanks to those individuals who are working across the state in those collaboratives, because they are working overtime to figure out what the needs of their communities are and how they can solve them. We are also working with the Nebraska Department of Education to identify technology needs for students from low-income families who are now studying at home. We're partnering with Motherboard to procure computers to refurbish for students in need. And Motherboard is a Nebraska-based electronics recycling and computer refurbishing social enterprise. And I want to thank Motherboard's owner, Stephen Toller, and all of his staff for working with us to help bridge Nebraska's digital divide for students in need. I also need to thank Tri-State Generation Transmission and Association. They are our initial gift giver. They are the first to step up and support us. This will require funds, and we can't thank them enough for being there for us. For any company or individual that wants to give funds to this, please visit neimpact.org. Again, that's neimpact.org. There are also on that website other resources, ways to volunteer. There are organizations that are still looking for volunteers, lots of virtual opportunities. And I also want to say, don't forget to go out and give blood. Also, I want to give one last comment about that neimpact.org. We are placing educational resource material for virtual learning to be used by teachers and parents on that website. So I encourage you to go look at that. They include all of our Now You Know Nebraska videos that we produced years ago, one for every school day of the year. Also linked to the virtual tour for the Capitol and to the Nebraska Atlas. So for teachers and parents who are looking for resources, it's there. And the last thing I want to say is thank you to all Nebraskans. I know this is a hard time, and we're all stepping up, and it just makes me so proud to be a Nebraskan when I see people taking care of each other and doing what we need to be safe. So thank you very much.
Thank you very much, honey. And would you say it's safe to say that kind of collaborative viewing is really a lot like what you're doing with Bring Up Nebraska to be able to bring those resources safe? So great job on the collaboration. Again, something we do really well here in Nebraska is we work together well. And then you mentioned giving blood, so thank you very much. We actually had a question about, does the Red Cross screen for COVID-19 when they're taking your blood? As I mentioned, I got my temperature taken twice when I gave blood a couple of days ago. They definitely checked the person to make sure the person is not somebody who's showing symptoms. Turns out that respiratory viruses, such as COVID-19, so any respiratory virus, including COVID-19, are not spread through the blood. So everybody can be rest assured that the blood that's being donated will not be able to transmit COVID-19 to anybody, because that's not how that gets transmitted. We had a question previously about Game and Parks Foundation and the state parks. Game and Parks, is going to be closing our state parks effective April 6th through May 8th. So this will be closing all their, the campgrounds, thank you for correcting me that. Nebraska Game and Parks will be closing their campgrounds from April 6th through May 8th, so that we can, again, discourage people who are coming here who would have to quarantine for 14 days anyway. So all the facilities, and it's also an effort, obviously, to protect our teammates at state government as well as our customers. Again, with the 14-day quarantine, it just doesn't make sense to have these campgrounds open, so Game and Parks is making that decision. So thank you, Game and Parks, for that wise move. Want to also give a shout out to our telecoms here in the state, especially Allo and Great Plains. They are all taking steps to be able to make it easier for folks through this emergency to be able to get access to the services that are helpful. So for example, Allo is, I think, cutting the fees for their internet service, and if you don't have internet service with them, they'll offer a 60-day free trial. Great Plains is waiving the fees for installation. We have Verizon, and they give us, 15 gigabytes, right? 15 gigabytes of hotspots. So again, so students can use that to be able to access their homework and things like that. So kudos to all of our telco companies, especially our homegrown ones that are really doing a great job to help everybody get through this emergency. So thanks, guys. In that category, thanks. Also want to give a shout out to Medica. You may recall last week we had the CEO of Blue Cross Blue Shield saying that they will be reimbursing providers that are using telehealth at the same rates as in-person doctor visits, and Medica has announced they're going to be doing the same thing. So again, congratulations to Blue Cross Blue Shield and Medica for that great leadership. We hope all other insurance companies will follow suit to be able to reimburse providers in a way that's responsible and fair, that encourages telehealth. Certainly during the course of this emergency, that's what patients are asking for, it's what doctors want. We encourage insurance companies to be able to pick up and do the same thing. Also in that category of people who are stepping up to meet this challenge here in Nebraska, we've talked a lot about University of Nebraska and the things they've done with the state, most recently working with us on these dorm rooms, but also at Innovation Campus, they are working to make plastic face shields for healthcare workers. They have a goal to be able to make 13,000 of them, manufacture 13,000 of them, and they are looking for materials like plastic sheets to be able to do that. If you would like to assist University of Nebraska and the Innovation Campus in being able to do that, please contact Shane Ferreter. You can reach him at innovationstudio@unl.edu. Shane, great job though, again, finding ways to pitch in and help out our healthcare providers to be able to make sure that they can take care of folks. Also want to mention that we have a call, or I'll be on a television show tonight with Commissioner John Albin. It'll be our NET show that we did last week, only we'll go back to the regular time. It's called Speaking of Nebraska. It'll be at 8:30 to 9:30 on NET tonight. And again, just like last week, there'll be the opportunity to be able to ask questions. And then finally, I just want to get back to, again, reminding people about we have to continue to practice social distancing, right? This is incredibly important that everybody takes this seriously. And I'm going to quote or paraphrase Coach John Cook when he says, hey, if you want to see football this fall, better practice these things, okay? Keep the groups to 10 people or less. Wash your hands often. Stay home when you're sick. The things we've been talking about, those are critically important. We want to make sure that people are doing the right steps. We're going to continue to work on testing. We're going to continue to look for how we can expand that testing. In fact, we're expanding it already to be able to not only include people, for example, that are at the hospital that present those symptoms, but also, our 24-hour facilities, people in our nursing homes, our healthcare workers, first responders, EMTs, people who are older, people who may have those underlying health conditions who are at risk. These are all people that will be prioritized as far as getting those tests as we continue to expand them. So with that, I'm going to go ahead and get into our questions here. And again, as always, we'll start with the questions that were emailed in ahead of time. This one from Sarah Kirkley at NTV, and I remind both of our guests, and Mary Jo, if you get called up, or Commissioner Bloomstead, again, repeat the question for folks. Is there any update when Nebraska may receive rapid tests? I believe what Sarah's referring to is something the President talked about on his phone call earlier this week. There is a test from Abbott Labs that supposedly will get done in 15 minutes. We have been told that we will receive some of those machines and some of the assays, but as I said earlier, we have not been given a timeline from FEMA as to when we will actually receive those. So, and this is part of our strategy to work with the federal government, but I don't have a timeline on those. Could you walk us through the process of a hospital or clinic getting a COVID-19 test? Is the state involved, or can providers get tests on their own? How are these tests divided out? What determines what number in each will be provided? So again, I'll just kind of hit upon some of those points I hit before. So if, again, you've got those symptoms, those flu-like symptoms, you've got the cough, you've got the shortness of breath, you've got the fever, stay home. First thing you do, stay home. Contact your healthcare provider. Let them know that you've got this and you want to come in. They'll make an appointment for you so that you can stay isolated. That way, we don't infect an entire clinic or an emergency room just by showing up. So this is very important. They will run you through the screens of testing you for influenza A and influenza B. Then the healthcare provider will have the option of doing that respiratory panel we talked about before, but it will now be optional. This is part of the ways we're expanding the testing, to give the healthcare provider the discretion to say that panel's not necessary. That panel can be expensive, as we've talked about in the past. Sometimes it takes a while to get done, so the healthcare professional then has the discretion to waive that panel and then go into the other screeners we talked about. So again, has the person traveled overseas? Has the person traveled domestically? Are they one of those people we just talked about? Somebody who works in our 24-hour facility, somebody who's a healthcare worker, somebody who has been in a nursing home or other kind of facilities like that. Somebody who maybe has an underlying illness or is 65 years or older. You know, those are all going to be conditions for somebody to be prioritized to get that coronavirus test. So that's what we are looking for, to be able to get that turned around at the public health department. Now, other providers can go out and go to commercial labs like LabCorp and Quest. Those tests generally take 4 to 7 days to turn around, but I think, Dr. Anton, we're getting about 200 of those. We got about 200 yesterday, is that about right?
About 200 returned every day now for the last several days.
Yeah, so we've had about 200 of those returned now every day for the last several days. So other healthcare providers are going to those commercial labs. They take a little bit longer, but they are able to do that as well, and so that's part that goes into the overall 696 that we tested yesterday. So, yes, other healthcare providers can get that as well. And then, and again, they're divided up based upon that criteria. So if you're in a rural area, if you're in an urban area, it's the same screen to be able to get that coronavirus test. We also, for example, if we have a situation like we did with Carter House and Blair, we will go in and we will test the residents, we will test the healthcare worker or the workers there and so forth. So that's another instance of where we will prioritize testing. So thank you, Sarah, for that question. Next is from Ryan Murphy, KNEB. When it comes to unemployment claims, some Nebraskans are going on week 3 filing unemployment and are getting nowhere, talking with the representatives at DOL. Our families are in need of wages, but keep getting canned excuses about timelines on when claims will be getting processed and what we can do to expedite this process. So again, I think Commissioner Albin laid out that there is a process that we have to go through to be able to follow the federal guidelines. I'm sorry if it sounds like it's a canned line back. We are working with the federal government on this, and we still have to go through their process. There are things that we have done here at the state of Nebraska, like waive the 1-week waiting period. We've waived the need to be looking for work or be able to take that job. We've waived the charges to the employers. So where we can, we've waived some of the things that we are under control of, but we also have to make sure we're following the federal guidelines on this. And John, I don't know, is there anything else you want to add to that?
No, we've doubled our staff,
Yeah.
doubled our staff working on it. We've gotten volunteers and others from our other programs like employment and training and labor standards. We're putting as many people on it as we can, and we're going to try and solicit some volunteers from other agencies who are freed up right now.
Right, so the commissioner has more than doubled his staff working on adjudicating the claims. He's getting volunteers from other agencies to be able to help out with this. So we are looking ways to expand that capacity. I think, as you said, Connecticut was hoping to pay in 40 days.
Yes.
And we're still shooting to get to the 21 days.
I mean,
21 to 28 days. So I certainly appreciate families are looking for that, and we're working on what we can do to do this, but it is a process that we have to comply with the federal government guidelines as well. All right, Taylor, do you have questions?
Bill Kelly at NET asks, police arrested a man they allege made violent threats against the director of health in Douglas County. Are you aware of other investigations involving threats against local or state public health officials or elected leaders?
So Bill Kelly from, where was that?
NET.
NET asked the question, police apparently arrested somebody who'd made violent threats against the public health director in Douglas County. Am I aware of any other threats like that to our public health officials? I am not aware of any other threats to our public health officials with regard to that. But I just caution you folks, look, I'll talk about what we had to go through this weekend with Carter House in Blair. Tara Ewing, the Three Rivers Public Health Director, worked around the clock to be able to cooperate with the state and the hospitals that were able to work with us to be able to take the residents, to be able to work with testing all the workers there as well as the residents. People are dealing with things that we never anticipated, right? Nobody was expecting a pandemic. Please understand your public health officials are working very, very hard. They're under a lot of stress. They've got a lot of things going on. Please be patient with them because this is something that is new for all of us, and we are all working to do the best job we can.
Becca Costello from NET asks, you ordered all schools closed down until May 31st after planning to do that for a few weeks. What changed that decision?
So again, who was it from again?
Becca Costello.
Becca Costello at NTV? NET, sorry. Becca Costello at NET asked, you hadn't signed a DHM previously closing schools. What changed? Actually, this is just a way for us to reinforce that, the message that we delivered Friday. And frankly, schools have been pretty much closed. How long? It's been like at least 3 weeks now? 2 weeks? A full 2 weeks now. So while this DHM gives clear guidance specifically around May 31st, the practical answer is that this has happened 2 weeks ago. We reinforced it again in a message with the commissioner on Friday. This is another way for just to publicize it and give more clarity.
William Padmore with KLIN is asking, how much testing is being provided by private companies versus the federal government?
William Padmore at KLIN is asking how much is provided by the federal government versus private companies versus, I presume he also wants to include the state in there. Actually, the federal government isn't doing any testing right now at all. They have not provided us any test per se. So they aren't doing any of the testing. The testing that's happening today in our state is happening at the public health lab. We've talked about that. We've got the capacity to do about 400 or more tests per day there. University of Nebraska Medical Center, they're about 300. We have hospitals like CHI that are running their own tests. And they're capable of doing close to 300, not quite. Then we have the private or the commercial labs out there that we're getting about 200 a day. So that's how it roughly breaks out. When we get some of the federal help with some of the federal machines, we can certainly start breaking that out. But as I said, we don't even have a timeline for when we're going to receive those machines or the assays that go with them. So at this point, those are the people that are doing the tests here in our state.
Ryan Boyd with KGFW has two questions. The first one is, with spring sports and activities being canceled, are public health officials saying anything yet about summer sports and activities, or are you going to reassess that at the end of the month?
Ryan Boyd with KFGW,
KGFW.
I'm sorry,
GFW.
KGFW, is asking about summer sports. Spring sports have been canceled. Has there been any guidance with regard to summer sports? And I think at this point it is just too early. I have not seen, Commissioner, I have not seen any guidance on summer sports. Have you? So the Commissioner has not seen any guidance on summer sports. I have not seen anything on summer sports. It's probably premature here on April 2nd to be judging about what's going to happen with those summer sports. But again, I want to reiterate something that I said yesterday. So we have the 10-person rule in place right now. And we want people to follow that. Okay, so that means, again, this is why we were talking earlier about club sports. Don't participate in club sports. It brings together groups of kids together that will then potentially share or spread the virus. So we're really working through this month on that 10-person rule. We've also issued DHMs that go now as late as May 11th. If we issue future DHMs, they will go later. Those include the 10-person rule. Even when we look and say that we can start relaxing some of these rules, we will not take them all off all at once. They will just be relaxed. So we may go from 10 to maybe 20 or 25, but we're not going to go to no restrictions. So keep that in mind as you're thinking about your summer sports, that these restrictions will be relaxed over time. They're not going to be relaxed all at once. So you can see that a lot will depend on how well people are maintaining their social distance right now. How well are you following that 10-person rule? How often you're washing your hands? Kind of like to John Cook's quote, right? If you want to see football, start practicing that stuff now. If you want to see the restrictions released sooner, everybody needs to participate in all these social hygiene, social distancing, physical distancing things we've talked about.
His second question is, with expanded testing, we're seeing more confirmed cases of COVID-19, yet looking around the United States, Nebraska's numbers are much lower. Why, what do you credit that to?
I'm sorry, who was the question from?
Ryan Boyd.
Oh, so Ryan Boyd again. We continue to see increased number of people testing positive. We talked about in the 30s the past few days, staying relatively stable, at least the last 3 days. And if you look around the country, while our numbers are growing, we're still relatively lightly impacted compared to other parts of the country. And why is that? Again, it really gets back to the difference that I described between New York and Nebraska. New York probably had the virus well seeded by the middle of January. And so they weren't even aware they had a problem. We didn't have those direct connections to China like New York does, or those direct connections to Europe either, for that matter, right? So we didn't have the virus getting here as quickly as it was in places like New York. And so we took the steps, like the ones the president recommended in March with regard to the 10-person rule, to start slowing the spread, relatively speaking, earlier in our cycle of the epidemic than places like New York. And because we are earlier, and we have this plan and we're working this plan, we have been able to control the spread. Now, that doesn't mean that we can relax. We cannot take this for granted. We've got to continue to work hard. That's why I keep hammering on this, is you want to see football, make sure you're practicing good social distancing.
We have a question from Chris Dunker. A lot of readers are concerned about Nebraska not having a stay-at-home order the way other states do. With the number of DHMs in place, is there a threshold when the governor will make that determination, or is there a number of positive cases or deaths that would push us to that point?
So Chris Dunkel of Journal Star is asking, a number of states have issued that shelter-at-home order, and is there, sorry, what? Did I get that right?
Yeah.
Yeah. So, and is there a point when Nebraska will do the same thing? And again, the name of the game here, folks, is really those large public groups. Okay, so what you're really trying to do is make sure that large groups of people, and when we say large, we mean 11 or more, right, don't get together. That's what the name of the game is. That's how you slow the spread of the virus. That's what our plan does. Our plan limits the number of people getting together. We put together this plan on, well, we got briefed on the virus March 3rd. We put together the plan starting March 6th. We implemented it starting March 13th. We were well ahead of the game versus other states that have the shelter-in-place orders out there. Our plan, as I mentioned, in some ways is more restrictive than some of those shelter-in-place orders. For example, Florida and the religious services. And so we don't have a shelter-in-place as part of our plan. When we worked with our experts at UNMC, that was never part of the discussion as needing to do it. It was very much around limiting the size of groups that are getting together. Now, as I mentioned, we saw the Surgeon General talking about staying at home. Yeah, that's still a good idea. You know, again, with the limits on public gatherings, staying at home is a really good idea. We talked about this yesterday with shopping. Send more one-person shopping. But we have no plans to do a shelter-in-place here in Nebraska. It's not part of our plan. We're working our current plan, and that's what has helped us so far, at least, keep the spread of the virus down, slowing the spread of the virus. Again, those cases, or at least the last 3 days, have been stable. We do expect them to go up, but we are continually reinforcing with people, don't get together in large groups.
Chris Dunker also asked, what is the process for people to quarantine at the university?
So Chris Dunker asked, what is the process for people to quarantine at the university? And I'm going to have to defer that one to President Carter or Chancellor Gold with regard to what their specific steps are at the university and let them get into it in detail. I hate to give out bad information. I can tell you my son, Roscoe, who goes to the University of Nebraska-Lincoln, is at home doing classes remotely for the rest of the semester. Anything else?
I think he was referring to the beds that were contracted.
Oh, with regard to the beds. Okay, so, sorry, I thought he meant students. So apparently that was about the beds that we have contracted with. So again, we're going to be working through, we've just signed the contract today with the University of Nebraska. We still have to worry about working on staffing and all the other protocols that will go along with that to be able to actually receive people. And we'll give you further updates on that as we go along. But certainly, part of what we want to do is make sure, again, this is a place where people can quarantine, so we will have the appropriate staff to make sure that happens, that those folks can get food service and janitorial service, and to the extent they need medical care, that as well. So you got it. All right, questions from the audience?
In regards to the
Yeah.
stay-at-home orders, I know
Yeah.
you're not doing anything statewide, you've said it multiple times. Are counties, cities allowed to get more strict? Is there any point where you'd step in and tell Omaha or Douglas County or Lancaster County that no, they can't do that?
Well, the question was with regard to, the state is not going to be issuing shelter-in-place order, and what about counties doing that? And, we just want to work collaboratively with the counties with regard to it, as we have done over the past. Again, our plan doesn't require it. It's for Nebraska, this is the right plan. And it's about limiting the size of those large public gatherings. That's what we're really focused on. So that's what I want all of our public health directors to really be focused on, is how do we make sure we limit that? And I'll give you an example. We've talked about some of the stuff with regard to the big box stores. The mayor of Omaha has been fantastic in reaching out and calling some of the managers and owners, asking them to take additional steps to keep people separated. They almost universally have taken steps to do that. She just sent me a text today about a picture from Lowe's and what they're doing there. So I think you see businesses doing the right thing, and that's what we want to see is, our public health officials, our mayors, reach out to organizations they think can improve upon what their current processes are and handle it that way. Paul?
So could cities do it if they wanted to?
I'd have to go look and see what a municipality actually could do. I don't know if a municipality, again, from Paul Hamill, Omaha World Herald, could cities actually do a stay-at-home order? I don't know if our cities actually have the authority to do that.
I know every day you're here and you start your news conference, comply with these measures.
Right.
Wouldn't the easiest way to make people comply just order them statewide?
So the question was, wouldn't the easiest way to be able to make people comply is just to order everybody to stay home? And I think this really gets back, and again, a part of our plan, again, we worked this plan out with our experts at the University of Nebraska Medical Center. And remind everybody, one of 3 biocontainment centers in the country, only federally funded quarantine unit. This is where, if you look at what happened when the United States was evacuating Americans out of China, they went to military bases or they came to UNMC, right? And we quarantined them at Camp Ashland. We are unique and recognized as world-leading experts here. And what we're focused on is, again, limiting those big public sites, and we also put together a plan that recognized the virus is not going to spread at the same rate across our entire state. And so what might be right for Omaha right now may not be right from McCook. And so we wanted to tailor the plan to that. Why is that important? Well, because we are asking people to do this for a while, right? We know at least statewide till April 30th and some parts May 11th. That's 6 weeks for some of those recently issued DHMs. What we don't want to do is have people do this too early, have people get tired, and then start breaking the quarantine, start breaking the ban, right? That's what part of this is about, is really tailored to make sure that we get maximum impact, but we don't wear people out of being home all that long, for that length of time. So that's why we've tailored it, and that's why we don't have to do a shelter in place relative to that goal of 10 people or less. Shelter in place isn't as effective as just making sure people are not gathering in groups larger than 10. So, and again, we've tailored across the state so we don't wear people out and they get tired of it and start ignoring what we're doing.
Of course, I went to a little town the other day, Dodge, they're merged with Howells, which is 7 miles away. Little Dodge, bars are closed. Howells, the bars can stay open. I mean, isn't there a problem there where you have mixing across these borders, and isn't it better just to say we should put the whole state under a DHM or a stay-at-home?
So the question was, Dodge and Howells, Dodge County bars are closed, Howell bars are open, huh?
Colfax County.
Sorry, Colfax County bars are open. Doesn't that create problems? Well, those problems exist anyway with things like, think about our commuters back and forth between Council Bluffs and Omaha, or South Sioux City and Sioux City, or some of our western cities where people may be coming from Cheyenne to work in Nebraska. So those kind of situations are going to happen anyway with regard to different kind of rules across, boundaries that are happening. So, but I mean, those kind of situations arise already. And again, what we're trying to do is really tailor this for the geographic area of the state so that we're putting it in place at the right time for that part of the state. And that's what we're really tailoring this plan around, to try and get the maximum impact with the least amount of disruption for the people in Nebraska. So we've tailored this to the different parts of the state so that we can do that and get the best compliance. And again, the real name of the game is keeping it below that, that 10 people or below in large public gatherings. That's the real key to this.
Part of that, not disrupting businesses, I mean, like stay-at-home orders.
Oh, so is part of this not disrupting businesses? Well, obviously, we're not trying to shut down businesses. Again, shutting down businesses does not actually get you what you want to do with regard to 10 people or less. It's about keeping those groups to 10 people or less is what you're really trying to do. So if you can have a business that can function, for example, we talked about by having 10 or fewer customers in it, that gets at your goal of keeping to 10 people or less. The goal is not to shut down businesses. The goal is to stop the spread of the virus. And to stop the spread of the virus, you need to keep it to 10 people or less. Shutting down businesses doesn't necessarily stop the spread of the virus.
We have some more questions. Charlie Brogan wants to know what is the status of our first-time claims for unemployment, and our last week's additional enrollees going to get their first check this week?
So the question from Charlie Brogan is status of initial claims, and that's that 24,527 number that I gave earlier. So again, that's a new record compared to the nearly 16,000 we had last week, and the previous record from the Great Recession, which was 4,000. And what is the status of those folks receiving a check? Again, John Albin's goal is to pay those checks out in 21 to 28 days, which is the federal guideline. Some states like Connecticut have said they're not going to be able to do it for 40 days.
He also has a listener who's receiving our office's emails from a govdelivery.com domain name, which is our domain that delivers emails, and just wants to make sure that those are actually coming from us.
So the question was, Charlie's receiving emails from a domain name that is coming from our domain, and are those emails coming from us?
Yes, govdelivery.com.
Govdelivery.com. Taylor, that's a great question for you. Are those our emails? Those are our emails. Yes, those are. So unless somebody's spoofing our URL, those are the emails that are coming out for us. So, but if it says something about me making kids repeat a grade next fall, that's not true. That was the April Fool's joke from yesterday. So that's not us.
Martha Stoddard has a question. What is the rationale for not requiring quarantine for workers coming into Nebraska, but making other travelers do a 14-day quarantine? Is the health risk different?
So the question was, again, what's the rationale for saying workers who are coming to our state don't have to quarantine? Truck drivers, railroad workers, et cetera. Versus somebody who's coming here as a snowbird, returning from Florida or Arizona, somebody who's got a lake house here. And it gets back to this idea of the whole goal is to keep groups of people to 10 or less. If you're coming back here as a snowbird, you are probably coming back and you're going to be socializing. You're not here to work. If you're coming back because you got a lake house, you're coming back to socialize, not to work. People who are coming here to work are, now those companies have to take the same precautions about 6 feet distance and no big groups of people working together, that kind of thing. So the companies still need to take those precautions, but they are not coming here to socialize. So that's the difference between the people who are coming here back here on vacation or because they're returning home from vacation. It's about those people and the risk of spreading the virus to large groups versus people who are working and are not looking to come back and socialize. They're working and going back home.
Don Walton has a question. Does Nebraska receive test kits, PPE, or ventilators from the federal government?
So Don Walton at the Journal-Star asked, have we received test kits, PPE, or ventilators from the federal government? We have received PPE from the Strategic National Stockpile, and we've received, I think, over half. Is it up to a third yet? Do you know, Dr. Anto?
For reagents?
For PPE, for gowns, masks.
Yes, I would say we've received about half.
We've received about half. So we've received about half of our allocation out of the Strategic National Surplus, which is our stockpile, which is based on population, and we've distributed that through our local public health departments. We may have received some limited testing from the federal government. Did we receive some test kits? We've received some test kits, but we've not received any additional machines like the Abbott machines we were describing before or any reagents to go with that. We are working to continue to buy reagents so we can continue to expand our testing. Wait, I'm going to go to Andrew because you already asked a bunch of questions, Paul. Well, don't worry. We've probably got time to get back to you. Don't worry, Paul. Yeah. Well, that's maybe why I'm coming to you, Andrew, because if he asks better questions, maybe I want to come to you. All right, John?
John, out of those 40,000, how many have you processed that you know that they're going to get it, but you're waiting for an answer from the federal government?
Well, we're not going to wait on the answer from the federal government for anyone at this point. We had hoped we'd get that this week. We have not, so we'll be releasing claims. In terms of the actual number that'll be paid out this week, in terms of raw claims. I don't have that number at hand. I know that the payments for this week that we have made were roughly double what we did the week before, so we are processing claims. We will get them through. But I don't have the actual number of claims that we got through this week.
But are you seeing, is there a percentage of how many, you know, you said they're fast tracked. You have a percentage of how many you're approving, you know, and you're not saying waiting, but to pay the whole amount, I guess.
Well, we take claims in the order that they're filed to a large extent, but you know, the claims will move faster that are a COVID-19 related claim where it's a layoff, they close the bar, they close the restaurant. Those will go faster, but I don't have a number for you, Andy.
So John, is it fair to say, though, that is a number we could start sharing, though? We can start looking at how many claims we're paying in a given week?
Oh, yeah, I can get you that.
Why don't we start doing that then with not only releasing the number of claims that were submitted, but how many claims that we paid for that week?
All right, I can
And
do
then
that.
we can go back and get some of the back numbers too for the last couple of weeks.
Okay.
Great, thanks, John.
I have a question for Commissioner Longstead.
Commissioner?
Thought I was gonna get out of here without that, so.
I am wondering if you have heard how schools and families are doing. I know we've heard from a lot of parents who are still working and who have young kids who you really can't put like a third grader in front of the computer and expect them to teach themselves. So have you heard just like, are there any ways to support those families who maybe the teachers aren't doing Zoom teachings or anything? It's like, you know, guided worksheets or anything like that.
So the question basically is how are families being supported, especially working parents, in providing education right now from their schools? And what I will tell you is I've seen a lot of different strategies. Certainly what you could see from a strategy of providing packets for elementary students and even middle school students, especially students that maybe don't have access to digital resources. Teachers are actually creating contacts. I've seen things on Twitter where teachers are dropping things off just to be visible at a safe distance, 6 foot or more, to be able to have some interactions with their students. It's really a unique moment in time. We're gathering resources and trying to get those to parents as well, just to understand how they can be helpful in interacting with their teachers. A big part of this is really working together, parents and teachers working really together to understand what's critical learning at this point in time. Obviously, it's a major impact on working families around what can happen. And we have to be very thoughtful, and our educators, I believe, are being very thoughtful about the types of supports that they're continuing to offer to parents in this time.
Similar question along the same lines for you. The critical years for those younger students or younger kids that are learning in the third, fourth, is obviously every grade is important, but those younger years where you're learning the numbers, those kind of things. How are you planning on making sure those kids don't go into next year if school's in session lapsed on that gap in time?
Yeah, in fact, I think yesterday I heard from one superintendent, you know, we talk about the summer slide sometimes with students that aren't in school and formally in school. And so the question basically is how are you going to address that given this? And there is a concern about this kind of COVID-19 slide for our students and thinking about strategies that'll really make a difference. We're engaging with NET and PBS National on educational resources. There's a lot of other digital resources that are out there. We're having conversations with libraries about how to ensure that we continue to push on our literacy and our expectations on those fronts as well. I think it's also really important from a social emotional learning perspective for our students that parents are being engaged with their children, but also that we're engaging from a school perspective. That's a learning part of this process as well. Certainly with our youngest learners, the reality is they actually have the most time to be catching up too, right? So we'll be able to come back and assess as we're getting back hopefully to a state of normalcy at some point in this process, but really assess where they're at and really focus probably on a much more individualized learning strategy as we come back out of this. I think schools have done remarkable things on that front, and parents are doing remarkable things right now. We're trying to provide as many resources as possible to help through this moment in time.
You know, if you keep standing up there, they're going to keep asking you
I
questions.
know, I'm leaving.
And just on that question about you can't expect a third grader to sit in front of a computer and teach themselves, I don't know about that. I think there's probably a lot of things third graders can show me about a computer that I don't know. With that, I think John Alvin has some updates. We were talking about the number of claims actually paid. So how's this for service, right? He got the answer, at least partially. So, John, can you come up?
All right. We do have the number. Last week, we cleared 7,686 claims, and then when you add in the continued claims, the ones that were in the system before, we ended up paying out on 10,539 claims last week.
Is that a record?
Probably. It's not a statistic that we've normally kept, but probably.
So what Andrew was asking was without a record number of claims paid, and we haven't kept track of that, but probably. All right, other questions? Paul, do we want to get back to you? Okay.
I had two questions. One is that
Wait. Really? So we finally come back to you and you're going to say 2 questions now? Well, okay, well, good. That's a good way to
one is
moderate
the
yourself.
Family Foundation is ranking Nebraska 43rd in testing per capita. Can you respond to that, and why would Nebraska be ranking so low?
So the question was, the Kaiser Family Foundation is ranking Nebraska 43rd in testing per capita, and why would Nebraska be ranking so low? And I have not seen that specific, so I don't know the methodology behind how they're doing it. But again, I think this also gets back to a couple things. One, states like New York and Seattle were impacted by this far before we were. And so they were doing more testing and also have been, frankly, getting prioritized to get more materials than we are here in Nebraska. So I think that's one of the issues. I think the other thing that is also important to point out is that when we put together our plan at the beginning of March, it assumed we would not have the type of robust testing that we wanted to have. We assumed that we wouldn't have a lot of testing, and that's why we have the rules of thumb, like that one community spread case in each of our public health districts to extend our DHM. So our plan actually considered that we wouldn't have that broad-based testing as we implemented it.
The other question is concerning stay-at-home orders. The governor of California, who I'm guessing you don't agree with a lot of things, said he'll never regret overcompensating. He's urging all states to adopt stay-at-home orders. Can you comment on
Sure, so the question from Paul Hamill was, the governor of California is saying, you'll never regret overcompensating, all states should do a stay-at-home order. And you know what? Again, our plan is right for Nebraska. Our plan is the right plan for us here in Nebraska. We need to do what's right for Nebraska. When the president issued the 10-person rule, we followed that guidelines. There was some question about, what would happen next. He extended to 30 days. We're continuing to follow that. But the president has also said that every state is different, and every state should tailor their plan to their unique needs. Again, it gets back to how we manage disasters in general in our country. Locally executed, state managed, federally supported.
We have time for one more question.
One more question. Wait, I'm gonna go back here. Paul did say he had 2. Was that 2, Paul?
I had 3, but
Okay, sorry, we'll go in the back then, Paul. You'll have to ask yours later.
I've seen people on social media, and we've had calls in with people wondering if the priority has been on keeping as many businesses open and as many people employed as possible, which is important, but if that's been prioritized over slowing the spread, how do you balance both of those things that aren't important?
Right, so the question was, has been keeping businesses open been prioritized over slowing the spread? And the answer is, it's actually been absolutely about slowing the spread. And it gets back to what I was saying about the key to slowing the spread of this virus is limiting the groups of people that are congregating together to 10 or less. Closing a business doesn't actually accomplish that goal, right? If a business can keep 10 or less customers and keep them spread out, that doesn't actually, that's fine, right? That's fine. It's about making sure you don't have more than 10 people congregating together. That's the priority. That's what we've been talking about. That's every day when I come in here, when I'm talking about that 10-person rule, that's why I'm talking about that. It's so important that we all, again, if going back to Coach Cook, you want to see football? Don't go to a group where there's more than 10 people. All right? If you're number 11, walk away. That's the way we slow the spread of the virus. That has been the priority. Closing a business doesn't actually help you stop the spread of the virus. Keeping groups of less than 10 people or less, that's what slows the spread of the virus. Well, again, folks, thank you very much. I appreciate it. Hey, nobody has any illusions that April is going to be a tough month. We've already seen that we've been able to expand the testing. As we expand testing, we are going to see more people test positive. We are going to see more, or likely to see more community spread and more directed health measures. It's going to be a tough month, but we will get through it together. But I can't emphasize enough what we've talked a lot about here today, which is if you see that group and it's got 10 people in it already, walk away. Do not go into groups of large people, and when we say large, we mean 10 is the limit. All groups should be limited at 10 person or less. So if you're in the park and it's a beautiful day, don't go to that group. That's why we're saying don't do club sports. We don't want, more than 10 kids congregating together. When you're out in public, even if you're outside, keep that 6-foot distance. That physical distance is so important to slowing the spread. These are the rules that will help us slow the spread of virus here in our state. We've made a great start on this. We need to continue to do more, and we need to sustain it through the month of April. And as we get close to the month end, we'll have a better idea how this is shaking out here in our state, and we will have new guidance for May. But we really need right now, the next 30 days or 28 days are going to be really important for everybody to follow these guidelines. Thank you all very much. Again, we will get through this. God bless, and God bless the great state of Nebraska. We'll see you tomorrow.